Welcome to Flourishing in Medicine from Surviving to Thriving. I'm your host, Dr. Mick Krasner, and this podcast is produced by EmPRO, a medical professional liability insurance carrier headquartered in New York State. We are committed to a number of peer support offerings to support the physicians that we protect.
And if either hassle goes up or hustle goes up, then clinician wellbeing goes down. And if both of them go up, then clinician wellbeing goes down exponentially. The other thing I like in that is the gross acronym of get rid of stupid stuff. And then the institutional belonging. What is it that we can do to belong in institutions or in practice? And that can be about inclusive leadership, it can be about appreciation, all sorts of things.
In this episode of Flourishing in Medicine from Surviving to Thriving, I'm pleased to welcome neurologist, mindfulness practitioner, musician, and educator Dr. Ross Carne. Ross reflects on the formative experiences that drew him into medicine, including witnessing his brother-in-law's seizure as a teenager, and how these shaped his lifelong desire to relieve suffering and make complexity understandable to others. He describes how mindfulness transformed both his clinical practice and his personal life, opening space for authenticity, deeper presence, and creative exploration, including jazz improvisation. Ross discusses his Belonging in Medicine program, which helps clinicians reconnect with intention, beauty, and collegial connections across individual, interpersonal, and organizational dimensions. He shares how these practices counter burnout and foster flourishing, and offers insights into the universality of the healer's calling across cultures. Looking ahead, he speaks to his growing commitments to narrative medicine, contemplative time awareness, and mindfulness-based stress reduction teaching aimed at helping clinicians discover and rediscover meaning, connection, and humanity in their work. And now, our conversation with Dr. Ross Carne. I'm really excited to welcome you, Ross, to Flourishing in Medicine from Surviving to Thriving. It's such a pleasure to have you, to speak with you again. And thank you so much for taking the time.
It's great to be here, Mick. Thanks for having me on the show.
I'd like to see if you can think about and then share with us beyond biography, like, I was born here and this happened here and I went to school here and then I did this training here. I like to get underneath that a little bit and ask about why medicine? What was it about you, about your upbringing, if that was a big influence, about your early educational experiences, about your early professional experiences that really made you want to make this commitment? And it is quite a commitment of time and energy and really moving your life in a very singular direction, at least for some time. And so if you could share that with us, that would be great.
It brings me back in my teenage years. My sister, her husband had malignant melanoma, and I was still at the time unsure what I was going to do. They would come down and stay with my sister and I. We were studying in Melbourne, in Victoria, Australia. They would come down from the country to stay, and in the middle of the night, on one of the nights, he had a tonic-clonic seizure. And I remember standing there and the sense of impotence at not knowing what I could do with this, how I would deal with this, not understanding what it was, and thinking I have the capacity to find out more about these things and to help. And that, I think, really is what set me on my eventual path. I loved the science, the way things hold together, the wonderful thing that the body is, and all of the mechanisms of that. One of the things that I have been good at during my career has been making some of those complicated things simpler for the people that I'm working with. So it's an interesting question about intention, I think. Ask people what was their intention to go into medicine. I think it changes. And I think, no, if mine was about helping people, am I actually helping people in the way that I thought I was? And probably the answer is no. No, it's. I think one of my helping things at the moment is actually helping people to navigate a system which seems to be as complex and as confusing as the body itself. Knowing where to go and what to do and how to do that's one of the things that I can help.
So you had this experience with your brother-in-law and witnessing this pretty dramatic. This is dramatic to any of us to see a tonic-clonic seizure, and then a desire to not be impotent in the face of that. So to dig deeper, I'd like you to see and reflect on why that struck you. Have any idea why you desired to really understand that and to be of service is the way I interpret it. Maybe I'm not interpreting it correctly, so correct me, please. Be of service in a situation that seems so you seem so helpless in at the moment. Why was that important to you?
Yeah, as you said, tonic-clonic seizures are awful. I mean, I think we're wired to know that they're awful. And to be standing there in the presence of my sister, his husband, and neither of us knowing what to do and watching this thing. I haven't been aware since, I think, of the same feeling of, I think impotence is a good word. It's just powerlessness in the face of what is happening. And to think that if there was a way to know how to help with this or how to fix with this or how to understand this so that I could better give solace to the people around me as well or help in that way. That's the why, I think.
I'm wondering, because I know you're a practitioner of mindfulness, bringing it up now, talking about it, and actually in some ways reliving it in a kind of historical autobiographical way. What's the experience now for you, somatically, cognitively, emotionally, as you share that? And can you recall how it's different and in what way to having that experience when you were 15, 16, or however old you were?
So that there are certainly echoes in my body now of the sinking in the chest of that feeling, powerlessness and desperation, that sense in emotion as well. So how does that change now? I guess I went on to study neurology and then within that epilepsy. I was an epileptologist for 17 years. And I guess the understanding is that, yes, this is here, but it's a universal thing. A seizure is something that our brains are wired to do. And if I were to have a tonic-clonic seizure or you were, it would run through the same sequence. It would look exactly the same. It would be as distressing for the people around us, but it's just something that our bodies do. And is that a consolation? I don't know. That's probably the extra understanding that I now have, whereas previously it was a case of n equals 1. It's actually part of existence.
What does that mean when we approach another member of our species and think about the fullness of their humanity, especially in medicine? It's so easy to reduce the person to the suffering they're going through in this moment with the condition that they've come to see us. But they're also that same person they were in some fundamental way when they were 5 or 10 or 15.
It's an amazing thing. And even with the mindfulness thing, this concentration on what's happening in the moment has a trajectory. It's come from somewhere. There's been an intention in the past. It's traveling somewhere.
I want to give you just a little bit of personal experience. My father, who's been gone quite a number of years, lovely man, great father. And I remember toward the end of his life, we had a number of conversations about living the non-superlative life, like the ordinariness of having a human life, and that sometimes, we do get caught up, and certainly in medicine, when you're pursuing it, trying to get into medical education, doing your training afterwards, trying to work in whatever setting, whether it's a practice or an academic setting, you're kind of working toward that superlative. We actually had these number of conversations, no conclusions, but well, what does it mean to think about our life as fundamentally non-superlatives? We're just living our lives. So I'm just curious about how you think about all the things that you've really pursued deeply. And for you, it's really just you.
The normal and potentially the normal thing for each of us is that we have different passions and different interests, and it's been such a privilege for me to be able to follow some of them. The mindfulness part of that brought an epiphany. This is nearly 10 years ago now. I was working at the time as a busy epilepsy consultant, seeing 30 plus patients a day. And I'd see people from time to time who would say, now, at the start of a seizure, if I really concentrate, I can stop it turning into something bigger. And I'd think, well, that's interesting. But then I'd move the conversation to something that felt more solid, and ask them about their medication or something, because I didn't know quite how to handle that. But I was then in the States at a neurology conference, and they had a talk on mindfulness. And they said, if you ever want to do research into focused attention, then this program, the mindfulness-based stress reduction program, MBSR, is the program for you, because it now has so much literature behind it that if you want to study it, you just have to say, we need MBSR, and people will nod and smile and look at the rest of the paper on its merits. And I thought, oh, well, that sounds good, but I'd better do it before I subject patients to it. So I went along to a community course and said to the instructor, I'm a doctor. I really just want to observe the course. And she said, no, you've got to take part. And so I ended up launching in, and I had registered that it was a mindfulness course, but I hadn't even registered the SR, the stress reduction part of the course. And so I turned up, and there were some really, really stressed people there. So there was a man who was there on a community treatment order for his anger management. So he didn't even want to be there, and he was angry. And then there were people at various stages of malignancy. A woman who was pregnant and had advanced ovarian cancer, an older man with metastatic prostate cancer. So people in all realms of stressful experience. And going through that program, the ability of that to bring the group together to some sort of collegiate, compassionate, connected whole by the end of the 8-week course was something that was just amazing to me, and taking part in that as well. I wasn't sure with that whether it was something about the content of the course or the capacity of the particular teacher, but then went on to study it. But the reason I say all of this is that in the end of the course, there's a question session where they say, well, how are you going to apply this to your life, this stuff that you've learned? And the teacher goes around and coaches each of the pairs as they discuss what intervention they're going to make, what change they're going to make. And I said, well, I drive my kids around. I had 3 kids at that time. They were teenagers. And when I'm driving, I'll be sitting there, and they'll be sitting there, and I'll be in my world and they'll be in theirs. What I'm going to do is to change it so that time when I'm in the car with individual children becomes the time for them, and I'll concentrate on them entirely. And this teacher, she's an amazing woman, she said, no, that's not good enough. This has to be a major change. That's think again. So I went back and I said, okay, well, what I'm going to do is I'm going to change my review time slots from 15 minutes to 20 minutes. And that extra 5 minutes, I'm going to make that about the person that I'm with, rather than just solving the problem that they bring. I did that. That was a huge logistic thing. It took a financial hit as well to do that, but it made a big change, and it made me realize that the people that I'm with are the most important thing. And and in flipping that around to look at myself and how I was engaging. And yes, I was, in your sense, very involved and very strident and on a career path as superlative consultant who that was all they did, and it occupied all of their time. But in opening up that time to look at other things, I have since taken on lots of other interests, which I think were perhaps in that superlative consultant um, mode were languishing. So it's made space for me to involve in language, in music, in other things, and it's been a life-changing thing for me, and a career-changing thing. So as part of that, I realized my other career is in neurophysiology, and I realized that in that space, I actually had much more space to talk to people about their experience as people rather than necessarily as patients. So I love the work that I do now. It's science-based. There's a background of knowledge. There's practicality. I get to speak about the history in the examination in the first few minutes, but then the rest of the time that I spend with the person, we talk about all sorts of things, and it's a wonderful experience for me, and works for the people too.
Yeah, well, thank you for sharing that, and also just connecting of this shift in what you have decided to do from the epileptology work to neurophysiology that has opened up something. And maybe it's not so much just wonder that shift, but how you actually oriented yourself toward whatever it is you decided to do, and the mindfulness helped. Which I want to include. I want to hear a little bit about, because I'm not a musician, and you've been playing music and piano for many, many years. And I know you play jazz piano, among other type of piano music. And can you speak to a little bit about what the effect of, this opening that in some ways with mindfulness, that in some ways brought you to realize the ordinariness and actually the extraordinariness of just ordinary moment to moment experiences. How has that informed your jazz and the way you play? Has it? Are you aware of it having any effect on it? Are you a different musician now and have evolved? I'm sure it's not like a light switch that goes off, but interested, especially because many of our listeners and viewers will have connections with music, either as an appreciator, as musicians themselves.
Yeah, it's also that I play a lot for myself, and I've become much less self-conscious about playing for myself in the presence of others. If the playing is coming from a place of authenticity, I think there's actually more to be said and more to be heard. Um, Before I had been aware that this idea of jazz improvisation, that if you sit down and you're playing to an audience and you play exactly the same thing, so the same note again and again and again, eventually everyone's going to get up and get bored and leave. Yeah. And at the other end of the spectrum, if you play this crazy stuff that makes no sense at all, everybody's going to get bored and leave. So you have to fashion something in the middle that has a basis of something that they know is building, and then they can see the building and that they can relate to that. And so I was very aware of improvisation as a communication method that needed to get the audience on board. And I think that's all very well, but I think there's probably too much awareness of audience in that, because it becomes harder then to come from a place of internal authenticity if you're so aware of whether what you're saying is landing okay for the audience that you're giving it to. So I think for me, I can run that process as if I'm doing that for myself, and if that then speaks to the audience, that's great. And my impression is that it more often speaks to an audience coming from that line, if that makes sense.
You brought up the word authenticity, and it reminded me, not to be so self-referential, but I will anyway. My wife and I, years ago, many years ago now, over 15 years ago, led a a workshop at a conference. It was a salon, a gathering, and having people talk to different groups of people just to kind of get to know about them. And we focused on three themes: authenticity, belonging, and then practice. What one practices in one's life to kind of just build skills and move through life, whether it's mindfulness, whether it's medicine, whether it's some other way of practice, those ideas. And, and they're somewhat connected. And you mentioned the authenticity, and you mentioned the connection with yourself playing, but also the audience that's there. And I know you've done a lot of really creative work in the domain of belonging. So I wanted to sort of that, shift the conversation toward sharing with us, if you would, about the origins of this belonging in medicine program. After all, this podcast is Flourishing in Medicine from Surviving to Thriving. So really, we want to explore ways in which you have yourself and shared with others ways to help them flourish. What were the origins and what was the ideas and how has it evolved and how is it being played out? And what are some of your thoughts about future iterations of belonging in medicine?
So I've been running this program called Belonging in Medicine in my local hospital. And it's a series of two workshops. It focuses on, again, that idea of individual, of interpersonal, and of organizational. So authenticity, belonging, and practice in a different context. So the individual, I come at it from a sense of belonging and a sense of not belonging. So the individual sense of not belonging might be around imposter syndrome. The individual sense of belonging might be something around where do I find meaning in practice, or for what am I grateful for in practice of gratitude. The interpersonal part, interpersonal not belonging might be how is my sense of presence with other affected if I feel that we come from different backgrounds by whatever measure, age, gender, sex. How does my sense of presence change? And interpersonal belonging, there's some good evidence now around having intercollegiate meetings where these sorts of issues are discussed. And then the organizational one, that there's lots around organizational not belonging. But so, for instance, the hassle and hustle, hassle is these are Mayo ideas. I think hassle is just the administrative load of what needs to be done, whereas hustle is the load of patients to be seen, the service that needs to be provided. And if either hassle goes up or hustle goes up, then clinician wellbeing goes down. And if both of them go up, then clinician wellbeing goes down exponentially. The other thing I like in that is the gross acronym, get rid of stupid stuff. And then the institutional belonging. What is it that we can do to belong in institutions or in practice? And that can be about inclusive leadership. It can be about appreciation, all sorts of things. But I think, as that has evolved and with the work that I've done, it's come back to three things that I find are the drivers, and perhaps they speak to authenticity and belonging and practice. So that they're the things I try to bring out to remind people of their intention to be practicing medicine in the first place, to attune them to beauty in practice, whatever that might mean to the person. That might be the beauty of finding flow in a procedural thing, or it might be noticing anatomy or physiology, or it might even be the beauty of interpersonal connection. And then the third thing is around connection. So intention, beauty, and connection, both to patient, but also in attuning to those things and speaking about them, the collegiate connection that can be there and can be very supportive rather than each of us working in an isolated silo. I think that part of belonging is really important.
I was thinking as you were talking that this experience in this belonging in medicine program is personal on one level. It's professional, it's really addressing professional challenges, but it's also very practical in the sense of you're really looking at real things that could be done to lower the hassle factor. Can you just summarize maybe just what you think the participants thus far are taking from this? How are they taking to it, and how is it helping them?
It's been really well received. I've run it so far for medical staff rather than a more mixed audience. One of the questions was around hierarchical consideration. Is it okay to have a resident and the chief of staff in the same room? And surprisingly, that has been really well received. That these people say that it's. I've had independent feedback from both ends of the spectrum about what a unusual situation it is for people to be able to share about these things across that verticality, and what a useful thing it is to hear from the other end of that. If I think of the features of burnout, like on the burnout scale, so emotional exhaustion, depersonalization, and professional inadequacy or a sense of professional cynicism. So within this sort of program, we bring things back. So we have people recall a situation. So think of a time in practice where you experienced X. It might be surprise, it might be compassion, it might be grief. And then the chance to reflect on that story and then to share it with someone else, so that there's a personalizing of this, which helps with depersonalization. There's an emotional connection to that, which just resting in and realizing the emotional content of what's being experienced, and then sharing that. And then the third thing is actually the sharing, that to have that experience heard and validated by a colleague overcomes this sense of professional inadequacy. So I think these things are directly antidotal to those components of burnout.
Our audience is probably mostly North American, but we hope that you'll help us get our audience in Australia to pick up somewhat. And I'm curious, maybe if you can just comment, just to give the listeners a little context about the practice of medicine in broad strokes, or whatever strokes you'd like to describe that, of neurology or medicine in Australia. And from what you understand, because you traveled a lot and you've been in a lot of places, especially you've been in North America and the United States many, many times, how it may differ, or how actually it may be very similar to the professional experience of being a physician, health professional in the United States and North America. Just some, if you can just kind of describe that to us, what you think is quite similar or different, or not.
I think it's very easy to focus on differences, but I think the similarities are really the overwhelming thing. The intention to practice seems to be very similar. There's a need amongst people who become healers to contribute in that way, and I see that really as universal. And within that, this dedication to doing that in the best possible way, so the hours of study and the working and continuing to work in spite of systems that are imperfect, and to deliver whatever can be closest to my ideal in spite of the system that I'm allowed or enabled to deliver that in. That these are the commonalities. And yeah, sure, those challenges are slightly different in different places, but I think the body of intention and dedication that's the thing that sticks out for me as universal.
Yeah, I would agree with you, because having done some travel and teaching our program to health professionals, physicians all over the world, I would say I 100% agree with the way you're articulating that. And finally, we're almost finished here. I wanted to ask you, because I find you as essentially a very creative person, an explorer in a lot of ways, a really curious person, and in a way that's probably ordinary for Ross Carne. It's lovely to hear about our colleagues' experiences and how they have those experiences because it does open up possibilities for each one of us listening. And even though we may see it as extraordinary, but for you, it's just Ross. Can you just share what are some of the things you're thinking of applying this creative drive and exploration to in the next 3 to 5 years? What is it that you'd like to be spending your energy exploring and creating and developing and working with?
I've been enjoying narrative medicine and the focus that that brings. I've spent some time recently making a set of workshops for clinicians around narrative medicine, which I hope to bring out this coming year. And I think the writing gives another way into some of these aspects that perhaps contemplative practice, it's slightly different. It attracts a different population of people. But again, it allows people to rest into story, to personalize the content, and then to share it in a way that is community building and affirming. So I think that's one of the focuses. Another thing I'm looking to do is there's a wonderful program through Stefan Schmidt's group in Freiburg in Germany, where they've had a program for hospital-based resident doctors about mindfulness in practice, and I'm looking to bring that through. It has some amazing, insightful modules in it, including one about time, which I think is fantastic. How does, if you have a really long to-do list and you get to the end of the day and you wonder where the day's gone, is there a way to actually make that a different experience by changing the way we experience time?
It's been a wonderful conversation, and just the time spent with you and listening to things and learning things about you that I didn't know. I've known you for a number of years, and even we visited together in Australia as well as here in the US to learn new things about you. It's been really enriching. So thank you. Anything else that you'd like to add? You don't have to, but is there something that you want our listeners to take away?
The thing that's coming up for me is a Rumi poem. Always. Yeah. He says, on a day when the wind is perfect, the sail just has to open and the world is full of beauty. Today is such a day.
Thanks for listening. We will include a short summary of today's podcast and some links to Dr. Ross Carne in the show notes. I'd like to share with you another brief practical exercise to help you flourish. Dr. Carne shared with us about his Belonging in Medicine program. And I'd like to explore belonging just in this moment right now. You're alive, you're here, and you belong. So I would invite you just to start first by setting your awareness to the present moment, grounding your awareness in the body right here, whether you're sitting, standing, whatever you're doing, noticing the feet on the floor if they're touching the floor, your seat on the seat of the chair, your posture, your sense of weight. Notice your feelings toward this moment. Notice the thoughts that are probably streaming in your mind, as so often happens, and we become aware of them as we settle the mind down. This body that we inhabit, these emotions that we feel from moment to moment, the thoughts that seem endless and stream, they're all a part of the experience that we belong to. That's right. We simply belong. We're here. We're alive. We're doing good work. We're connected to ourselves, to others, to the work that we do. We live in neighborhoods. We have places where we spend time with our friends and family. We have places where we work. All these are part of our belonging. Perhaps once, every so often, you can just settle into your place in the moment, right here, right now and give notice to this sense of belonging, the truth of this belonging. I hope you find this podcast and the simple exercise useful to you, and look forward to having you join us for our next episode of Flourishing in Medicine, from Surviving to Thriving. If you would like to learn more about EmPRO Insurance Company, please visit www.myempro.com. If you'd like to know more about EmPRO's peer support programs, you may visit www.myempro.com/peer-support. If you're a physician or a student, medical student, and in the need of urgent support, please consider calling the physician support line at 1-888-409-0141. For more information about me and my work, please visit www.mickkrasnernd.com or visit www.mindfulpracticeinmedicine.com. I look forward to seeing you again at the next Flourishing in Medicine, from Surviving to Thriving